Good evening, everybody. I'll talk here about COVID-19 and diabetes, both some Mcqs. Which of the following is not risk factor for mortality in patients with COVID-19 infections? So A, diabetes mellitus type 2, hypertension, male 6, female 6, older age. I'll give you some seconds to think about correct answer. So correct answer is female 6. So female can increase the risk of mortality compared to the other groups. Second question, which of the following statements about type 2 diabetes and COVID-19 infection is true? A patient with DM type 2 are more likely to transmit COVID-19 infection. Patients with type 2 are more likely to acquire COVID-19 infection from others, or are more likely to have severe form of COVID infection. Patients with type 2 are more likely to respond to dexamethasone treatment for COVID-19. Remdesivir is contraindicated for COVID-19 infection in patients with type 2 diabetes. So the answer, correct answer is C. Patients with type 2 diabetes are more likely to have severe form of COVID-19 infection. And it's not true that patients with diabetes are more likely to transmit or acquire infections, but they are more likely to have severe form of disease, and they respond well to dexamethasones, except for the effect of glycemic control. So next, I'll go to question number 3. Which of the following anti-diabetic medications considered safe in patients with severe COVID-19 infections? DPP-4 inhibitors, SGLT2 inhibitors, GLP-1 inhibitors, metformin. So the answer is DPP-4 inhibitors are considered to be safe, and other medications, SGLT inhibitors, GLP-1 inhibitors, and metformin do have some concern and should not be it should be stopped in some patients with COVID infection. Next question, which of the following statements about use of insulin in patients with type 2 diabetes and COVID infections is true? A, use of insulin should be avoided to minimize risk of hypoglycemia. Only long-acting insulin analog should be used in patients with COVID infection, DKA. Insulin should only be used as IV infusion and only patients in ICU. Use of insulin in patients with COVID-19 infection is associated with worse prognosis. Insulin use in patients with COVID-19 infection should not be stopped. So think about correct items. So the truth is that insulin use in patients with COVID-19 infection should not be stopped. Well, because insulin actually associated with better prognosis during hospitalization. So here the last question, which of the following statements regarding COVID-19 treatment in patients with type 2 diabetes is true? So A, established guidelines for COVID-19 treatment in patients with type 2 are based type 2 diabetes are based on the well-controlled studies. B, the guideline for COVID-19 treatments in patients with type 2 diabetes are based on the expert opinions. The hemoglobin A1C goal for patients with COVID-19 infection and DM type 2 is less than 8%. Use of dexamethasone in COVID-19 infection is associated with improvement in glycemic control in patients with type 2 diabetes. So correct answers here that the guidelines for COVID-19 treatment in patients with type 2 diabetes are not based on randomized controlled trials, but based on expert opinions because experience have been gained but still have some controversies. Thank you for watching and listening.